All right, Diane, I think we made it.
Yes.
We're live. We might be a couple minutes late, but we're here, right? Better late than never. It's technology. I'm actually keeping my fingers crossed that, it's very rainy here. So I'm keeping my fingers crossed we can get through this without any further tech issues. But hey, it's technology. Well, welcome to the show, Diane. I'm so excited to have you here. And let me just say, too, on behalf of Sarah and myself and the Cancer Equity Project team, we're so glad to have you as a board member because you bring such, wonderful insights and energy to our team. And so we're just happy to have you here. I'm going to read a little bit of your bio, just a little bit, and then I want you to fill in the rest for us. All right. So Dr. Diane Perez is a well-known physician, health communication specialist, scientific writer, journalist, author, and television host, and she never sleeps, who has been a prominent figure in the Spanish speaking media industry for over 20 years. Diane, when I read your bio in getting ready for this show, I'm like, so she's writing books, she's doing shows every day. When do you sleep? So, Diane, I'm going to turn it over to you. Tell us a little bit more about yourself.
Dear Sharon, thank you so much for this wonderful opportunity of being with you in this incredible show. And yes, I feel very honored to be part of the board of Cancer Equity Project. I think we definitely need a foundation like this in order to help people to transit through cancer and help people that are in serious disadvantage regarding healthcare. So yes, I'm very excited to be part of this incredible organization and to be with you. I am a physician. I've been a journalist for more than 25 years, medical correspondent for Televisa in Mexico. Now it's NMas, Televisa Univision. There's very interesting fusions there, and I'm very excited to be part of all this new era in Hispanic television for trying to spread the word about the most important health issues that can be prevented and helping the community to try to do something about their own health and
Yes.
their family's health.
Dan, as you were talking, I was saying to myself, and I'm so, it's such a blessing to have, you know, you're not in advocacy, but you're advocating. You're a voice for, your community. I'm trying to be a voice for my community. We represent the minority communities, but we doesn't mean that we have to have a minority voice, right? We can have a majority voice for our people, and we're not trying to say we're speaking for our people, but the Lord has put us in a position where we can bring awareness through our work for what is happening in our community. So today, I want to talk about some of the challenges that the Hispanic community faces when it comes to healthcare. We sometimes think disparities. It seems like it's black and white or black versus white, and what we're trying to bring forth at the Cancer Equity Project is that it's black, it's white, it's Hispanic, it's Indian, it's rural, it's poor, it's really every group that's underrepresented. It's LGBTQ. But today we want to focus on the Hispanic community because there are unique challenges in each subgroup. And I wanted you to tell us, what are you seeing as the unique challenges in the Hispanic community?
Yes, so I see many definitely because when you speak about the Hispanic community in the United States, you have to consider like a broad spectrum. First,
Hmm.
you have those who are undocumented, who just arrived to the United States, which is a huge group. They do not speak English, they do not know the culture, and they are scared about being caught and being sent back to their countries and their situation. No, so you have that group, which is very challenging
Hmm.
for the healthcare system. Then you have those who are here that came with their package of unknown things, but they are documented here and they have access to healthcare, but still they are facing a very hard cultural cultural difference, which is
Hmm.
important. And on the other hand, you have those who were already born here, but are the children of those Hispanic immigrants and understand more the situation of this country and how healthcare is provided in this country. But still, if you are not part of this from your family, you will probably have a hard time to understand how all this healthcare system works, because it's absolutely different from those countries south from the Rio Grande.
Yeah, it is. You talk about, someone may say, well, why should we care about undocumented? Whether you want to care or not, I think the fact remains is that we have undocumented people here. And it's not just Hispanic folks. We know there's Jamaicans. I'm a Jamaican, myself, and there are undocumented Jamaicans here, undocumented Caribbean people here. We more hear about the Hispanic people because of the quote unquote border. So it's more in the news, but undocumented people live amongst us and work amongst us every single day. And you mentioned that one of the unique challenges, Diane, I would think, because I heard some anecdotal stuff on the language, that because Hispanic people speak a different language than even, let's say, an African American, they're sometimes overlooked in the healthcare system when you go to a doctor who doesn't have a translator, who doesn't understand what they're saying. They're kind of like shoved to the side. So you have, not only do they have the other social determinants, right? Now they have a language situation. So speak to me a little bit more about that. Like, what is the workaround? Is there a workaround with that? I mean, what can healthcare providers do? What can community leaders do? Community advocates do to at least, eradicate maybe a little bit of that barrier to healthcare? What are your thoughts on that?
Yes, I mean, I think there is much that is being done in this sense. You have different organizations that are facing this. For example, the National Hispanic Medical Association, who is a group of Hispanic physicians that can help others that are not Hispanic to face these barriers of cultural thing, because it's not only the language, even if you speak the language, that might help, but it's also the culture. For example, in Latin American countries, you have this shaman figure. There's witch doctors that people even very, very literate in many senses, and people who are wealthy, they still, some of them, go to this kind of witch doctors when there is no hope in their point of view in science,
Yes.
So you still have that figure that, as a scientist, probably I could respect the fact of the psychological effect of that, but unfortunately it's something scientifically unknown. Sometimes it might work for them, but it also puts them apart from a real treatment. And for example, many times when we talk about cancer, you have people that go to these kind of alternative options, and they do not receive the proper treatment voluntarily.
Yes.
So that's one cultural aspect that needs to be considered. On the other hand, you have other cultural behaviors, like, for example, in the case of breast cancer, you still have, I mean, it's less and less, fortunately, but you still have in certain communities this macho figure,
Yes.
this male figure that doesn't like his wife or his female partner to be touched by a male, even if it's a doctor. So there is another problem that you need to face. And when it comes to the language, of course, if it's people who do not speak English, that becomes very hard. But even if it's someone who speaks English, sometimes the pronunciation is completely different, and the name of the diseases is completely different, even for Hispanic doctors. I see Hispanic doctors who speak English, but sometimes it becomes hard to translate all the medical terms to English. No, so of course with the Latin roots of the words, it helps, but it's definitely a challenge. The language barrier is really hard to surpass, but there are efforts made. I mean, in many places you have the option of having people speaking Spanish, translators, and that definitely helps, but it does not solve the whole problem, because you have this cultural barrier also.
Yeah.
In some countries of Latin America, for example, and let's not talk about Spain, which is something different. I mean, Spain is a European country, even if it's Hispanic.
Yes.
The way the whole system works is different. But in Latin American countries, you have the doctor figure, who is kind of a psychologist too for the patient. And then you come to the United States and you see that a physician has a certain amount of time that he can spend with the patient, because
Yeah.
he needs many other patients. And now that I'm doing this master in healthcare management, I totally understand this time management for physicians. No, that it's impossible that the physician can spend an hour talking with the patient, because he really needs to put his knowledge in other patients too, to benefit them. No, so there is really a system that needs to work and it's completely different as in other countries. So the patient comes to the United States and does not understand why the doctor can't sit with him and chat for half an hour or an hour about family, about other things that are not exactly related to his health issue. So those are examples only of the cultural differences, the barriers that are beside the language, Sharon.
Diane, you said so much that my head is spinning. So you lost me someplace. Let me tell you where you lost me. So I understood about the shaman because I'm a Jamaican, and so yeah, we have our version of a shaman there. And yes, a lot of people go there because they have faith in that, right? They have faith in some countries have it as voodoo, right? They have faith in that kind of magic. But I never thought of the macho thing, which I know exists a lot in some of the Hispanic community, but I never thought that a husband, may stop his wife from getting treatment for her breast because he doesn't want the breast any kind of gynecological, examination. And that is my goodness, that is such an eye opener for me today, right? It's because that's a hurdle. That's a cultural hurdle. That's your going against your husband. I mean, that is a lot. So that I kept thinking about, like, oh my goodness, what do those women do in a case like that if they can't find a female oncologist? I mean, it is, we Americans or other cultures can say that's nuts. You can say it's nuts, except that it's people's culture. And our cultures are ingrained even to the point where it affects our health. It's just like even in the faith world, there's a certain belief system, and it doesn't matter if, it's life or death. They're going to stick to that belief system. And so that really got me there. Let me see if there's any questions there. Not to mention this other stuff that you said. And you also touched on, you had Spain, Hispanic. I know Sarah was in Puerto Rico recently, and she was talking about the, Hispanic is not just one sect. It's like Spain, Latin America, you have Mexico, Puerto Rico. And so that makes it even more complicated when you're not knowledgeable and you lump every Hispanic in the same bucket. That's a disservice, because we're not taking into account cultural differences, because a person in Spain who's more European may not have an issue with their wife going to a doctor, right, for a breast examination, but a Latin American husband would have a problem. So it is a lot. It is a lot to take in. Let me just take some comments here.
Again, in that cases, it depends also of the socioeconomic level. Of course, in more cultivated and educated people, you don't have that as in people who don't have access to education, which is
Yes.
a huge proportion in those countries. And sometimes those people come as undocumented to the United States to seek better opportunities. But they still bring those cultural beliefs with them,
They do. And you know how it is for immigrants. We all tend to live in pockets, right? To reinforce culture. And so it's like a circular conversation. So it's very hard if you're, if you're an immigrant, if you're not educated, it's very difficult. And Sarah was just reconfirming that the point that we made, that the Hispanic community is broad, Puerto Rico, Cuban, Dominican, Mexican, and more. Peter says, welcome, Dr. Diane. What do you think are the most important challenges for Hispanic populations with cancer? Is it in screening, diagnosis, or treatment?
Well, I think that first of all, as we already spoke in our group among the participants of the Cancer Equity Project, Hispanics are underrepresented in clinical trials.
Mhm.
So beginning there, I mean, you don't know exactly what's going on with Hispanic people. Where we know from certain studies that have been done that they have specific mutations. For example, in the case of breast cancer, you have specific mutations in Mexican women, for example, that make their breast cancer to appear at a younger age and to be more aggressive than Caucasian women. So there are differences when it comes to genetics, first of all. And the main problem is that they delay the diagnosis.
Yeah.
They don't go under the screenings on time, and that may be caused because of culture, of language barriers, of economical lack of access, of lack of insurance. When they are undocumented, I mean, they don't have access to the healthcare system, to the regular healthcare system in the United States. So they don't undergo those screenings. So the diagnostic may occur later, unfortunately.
Yes.
That when it comes to treatment, again, you have this issue. If they don't have insurance, it's very hard to pay for the healthcare. And when it's cancer, I mean, you go bankrupt immediately.
That is so true. That is true. Those are some serious issues, and go back to the cultural issue again about the screening. That's an issue. And I know with our Ebony trial, I know Sarah's, our goal here at the Cancer Equity Project is to have a majority minority enrollment. And so even as we talk about majority enrollment of Black women, I know she's thinking of Hispanic women as well. And, as you're saying, there's certain mutation. There's so much work to do. I'm sitting here and I'm thinking, my goodness, we have so much to do as a country, but in our small part here at the Cancer Equity Project, I'm glad you're on the team because you are that voice, for the Hispanic community. And as we develop, educational programs, I'm going to be really leaning into you, Diane, to help steer that, because you know the audience, and you're telling us things that I didn't even know, So, I mean, I'm glad you're here. See, Sarah says National Hispanic Medical Association, When you mentioned that, National Hispanic Medical Association, and how the opportunity is there for those doctors to cross-train a little bit, right? The American doctors. I was thinking of our SEEK program, and Sarah was thinking this. I know Sarah is always in the feed. I was thinking of the SEEK program that we do, that SEEK training, that we should get doctors from this group, National Hispanic Medical, to speak at our SEEK program. So Diane, I'm going to need some information from you so that we can get them on our agenda. Okay.
That's very important. And I would like to say also that for patients, I would like to recommend another association that can be very helpful. And I would like to recommend two things. One is the National Alliance for Hispanic Health. That is a great association that provides information, that have these promotoras de la salud, or these community workers that can bridge this gap between the community and the doctors and help with these cultural differences to break these barriers. So I think this is a very, very good option. And another one that I want to mention is the Patient Aider app that everyone can have totally free in their phones, in their telephones. It's the Patient Aider app. And the Patient Aider, what it does is that it provides in English and in Spanish information for patients about what to do when they go to seek healthcare, either in a hospital or just go to a consultation with a doctor, all the things that they have to ask. So this is very important. Good. Patient safety, and I really want to mention it because it's totally free, Patient Aider, and it's in English, it's in Spanish, and in many other languages too.
And as you know, we're working on our exciting Compass Journey Map, and which you're helping us with the Spanish translation. And one of the things that that Sarah said, and I totally agree, is that we will not launch until we have the Spanish version ready to launch with the English version, because of exactly what you're saying right here, that sometimes we put it on the back burner, and it's like it's never caught up. And so I'm hearing you today, I realize that, again, as I come from a Black perspective, I know the pain from my side, from my people, but hearing your side and what you're seeing out there, it's like it's the same, just differences in color, maybe, and difference in language, but it's the same pain, and
culture, because
yeah.
Let's not talk about color. Let's not talk about language. It's culture. It's this,
yes,
this that you have inside of you, that you've learned all your life, and then you come to a completely different situation, and you need to bridge that, and you don't have the tools how to do it. You don't know where to start.
Yeah, we have work to do, Diane. Peter says, what do you think are the most important avenue for outreach in the Hispanic community? That's a good question, because I was thinking that myself. You talk about bridging the gap. We talk about, these different groups, but how would, like, a cancer equity project team, how would we reach, the Hispanic community? What would be the most effective way?
Well, first of all, I think we need to organize like a campaign to try to get this information to the right people, to the Hispanic community. When it comes to my niche, the Hispanic niche, because as you said, there are many underserved communities that need exactly the same. But in this case, I mean, for Hispanic, we need to open it, and we need to open it to social media, through traditional media, through the Hispanic doctors, through the researchers, to have the Hispanic community included in the trials. And we need to spread the word. I think that we need to educate not only the community, of course, regarding the importance of screening and getting your consultations regularly with the physicians, but also the healthcare providers, the hospitals, the medical associations, about this importance to break and to bridge this gap of cultural differences.
You see how many times we come back to the whole culture conversation, because it is so entrenched in our communities, right? Ilana says, living in South Florida, I have watched Cuban patients who don't speak any English and suffer going through the health system. Although there is some information translated, so much is not kept up to date. Do you see hospital systems and physician offices making efforts to have Spanish translation on their websites? Good question.
Yes, I see that many. Of course, I live in California, and California has a very high proportion of Hispanic people. You know that. But
yes.
I see that, for example, the Centers for Disease Control and Prevention, the CDCs, have their website in Spanish too. So there are a lot of tools available for Hispanic people. The National Institutes of Health also have information in Spanish. So I think the efforts and the intention is there. The thing is that seems that it's not enough. We need to
Yeah.
do more, and that we need to keep on doing it, because any effort and any initiative that starts needs to be there and to be repeated, as
Yes.
they say in Latin, no? Repetitio est mater studiorum. Repetition is the mother of studying, of learning. So we need to be there, we need to be present, and we need to keep on doing all these efforts all the time, and not slow down, no matter what is the party that is going to be, or it is in control of the country.
Doesn't matter.
That doesn't matter. Health is an issue that needs to be addressed no matter what, and it's very important to have it from all the aspects.
You know, when you were talking, I kept thinking we got to double down, triple down, quadruple down. Vicky says, I know of a woman of Mexican ancestry who has responded well to 6 radiation treatments, but needs a right breast mastectomy, and her husband does not want her to have it. Been trying to help him understand. Wow, Vicky. I mean, this is, oh my goodness. This is it comes back again to the cultural conversation. And I work with a team that plans the agenda for Seek, right? And we've had a couple on cultural communication, but this is bringing it to a whole different level, for me.
And we talk about this for breast cancer, but on the other hand, you have a similar issue for prostate cancer, and the screenings, and the screening in the rectum for the males. I mean, it's very hard for these people, these machos, to have an exam of that, like that, which is very, very important, very necessary, and it is and it's not expensive. I mean, and they just feel that they will lose their male essence if they undergo a test like that. So it's a very hard to face.
It truly is. All right, some more questions here. Diane, surveys we have conducted have shown that Hispanic patients often don't know screening guidelines, like when to begin getting mammograms or colonoscopies. And 1/3 of the patients in our survey had never been asked about their family medical history. Can you speak to that, Diane? Is that part of the whole culture thing again that we're talking about? And I know the medical history thing is in the Black community as well, because there's a lot of single moms. There's a lot of, people don't talk about it. So is that similar in the Hispanic community?
Yes, definitely. I mean, it's part cultural, and as you say, many times the mother is left alone with her children, and maybe she doesn't even know the medical history of the father of her kids. Sometimes one woman has 4 children from 4 different fathers, and you do not know the history, and that burden comes to the children that do not know what medical history they have, their families. So yes, it's a very difficult situation, and I mean, hopefully we will be able to figure it out, but it's really hard, because you don't know, you don't only have what you have in front of you, but you can't get information from the grandfather, the grandmother, etc.
So as you're talking, Diane, right, again, being a person from an underrepresented group myself, I'm from the Caribbean, you mentioned about, the 4 different children with the 4 different fathers. And there's a tendency, and this is part of the problem, right? There's a tendency to judge, right? To say, 4 different fathers, 4 different kids, And God, this is where we need compassion, in the healthcare system, and empathy. That this again is part of conditioning, part of educating. It's where when that Hispanic woman walks into your practice, please stop the judgment, because that's where it hurts the treatment. It's almost like you feel like it's deserved. And I'm just saying that as a woman of color myself, who I am used to in my culture where, yes, like you said, the mom would, have 3 kids from 3 different guys and whatever. And it's just economics, right? It's terrible. And this is part of the underlying issues that we have in these underrepresented groups is the prejudgment, and then maybe not treating you as equally as you would treat someone else who you perceive to be upstanding. I'll leave it for that way.
What you say is absolutely important, and how can we promote greater cultural sensitivity and inclusivity in hospitals and practices? I mean, there need to be guidelines in this.
Yes.
That prejudice is not allowed.
Yes.
I mean, you really need to live the life of those people to understand their situation. I mean,
yes.
You cannot do a prejudice. It's not allowed. That should be that should be like I don't know, some kind of punishment for those who do a prejudice, no, or judge people who's entering. I mean, when you get
I'm with you, Diane. I am with you 100%. And when you're talking, because I understand exactly where you're coming from as a Jamaican woman, I'm like, this is where the judgment starts, and it shouldn't be allowed in healthcare. It shouldn't be allowed in healthcare.
Maybe the word punishment is not the right, but I don't know if you understand.
I know what you mean.
I mean, some kind of consequence that
yes.
healthcare providers that are making a prejudice or are not acting equally with
right.
They have to face a negative consequence in their record, in their opportunities to grow, in their payment. I don't know, somehow, because that is not allowed. You really need to be in the shoes of the people who are coming into the hospital to seek for healthcare, and that can also be a problem that might cause that they do not go to get healthcare.
Exactly.
They want to be judged.
Yes, because of the judgment. And this is why I love our Seek, color workshop program. And I know it's in its infancy, but I'm excited by it because we're bringing conversations like this to doctors. And we're saying, this is what's happening. And we're hoping that it will begin to open eyes. And I measure success if one doctor changed their practice, that's some success. And hopefully it will continue. Raquel says, how can we promote greater cultural sensitivity and inclusivity in hospitals and practices? You want to take that one, Diane?
Yes, I mean, I definitely think that there need to be consequences for those who who are not sensitive and do not treat equally the patients. But also there needs to be also like gratification, some kind of opportunity to grow versus the opportunity of not, for those who are sensitive, who are giving the proper care, who are giving that no judgment care.
Yes.
And also would like to include one group of the population that, even if they are not racially or ethnically underserved, they are still underserved and judged. And those are the people who suffer from an addiction.
Yes.
Unfortunately, they are also, when they come in a hospital, in a healthcare facility, there is always the thing of some providers that say, oh yes, because he deserves it because he did it. I mean, you don't know the situations of that people, of how they got into that.
Yeah.
And now they are facing a problem. So that is also an underserved population that definitely needs help.
Diane, I wish all doctors had your heart, my sister, because that's the heart they need to have. Isn't that what the Hippocratic Oath says, that you should kind of like be fair? Isn't that part of the oath that you guys take, when you graduate medical school? But unfortunately, the human part of us is what prevails. When you walk in that hospital room. That's what's prevailing. And that's the reason why, again, I'm excited about Seek. And I know that Raquel is on the line, and Ilana, as we plan these agendas for Seek, hear what Diane is saying, there's so much work to be done. And as we choose our topics, we really want to do our part in bringing this in front of the medical community. Elena's asking, so interesting about those of Mexican descent. Do most oncologists in the US know that?
I'm not sure they do. I'm not sure they do. This is a very interesting research that was done together with the City of Hope and the Instituto Nacional de Nutrición in Mexico, and they found out these specific mutations. But it's very important to give a culturally and genetically competent care for patients now.
Yeah. Ilana, it just means that it's just more work that's left to be done. Peter, you're our scientist. Great point about the prostatic screening, and culturally must be a huge problem to talk about things like impotence and sexual dysfunction. Absolutely, Peter. Absolutely. Even to some degree in the Black community as well. But I will say, from what I know of the Hispanic community, I would say they're a little bit more sensitive than even the Black male, who is also quite sensitive about that topic. Vicky says, amen on the judgment and prejudice. Remember that body language of an HCP can also be very hurtful. Great point, Vicky. It's sometimes not what you say, right? But we can always, anyone can feel a body language. Anyone can feel like, I'm not getting the eye contact. No one's shaking my hands. No one's looking me, no, they're talking to me from their side. Yes, Vicky, the body language actually speaks louder than words at times. Peter says clinicians and providers need to understand about microaggressions. I think he linked a YouTube video. I think it's from one of our SEEK training. And so, again, we're doing our part. Diane, this was supposed to be a quote unquote 15-minute talk.
That's sorry. You give me the microphone and I just did not stop.
No, it's the audience. I'm trying to answer their question. No, we're learning a lot, and so we're gonna have to have you come back on, because we have to scratch the surface. I want to go deeper into some of these things, and maybe we bring somebody else on from one of your group here that could come along with you as we explore more about these issues that we're talking about today. So, we like to end our show with something uplifting. It's called T Talks because of the T cells in our body that fight cancer. And they're the happy cells. And this has been such a great conversation. So many takeaways for us. Just even me on the program side of cancer equity and total health, like, oh, geez, we're just scratching the surface. But again, I'm glad you're on the team, so you can help us scratch deeper. Vicky says she's done. Diane, I am half Puerto Rican, and my grandfather and uncles refused prostate exams and colonoscopies. My gosh. Diane, we have to talk about the next time you come on. Maybe you can think about this, because culture is so hard. How do we get around culture? We can't do it in this conversation, but it is really important. How do we get around culture? Has anyone done that successfully? And if they did, in other words, is there a Hispanic man that we can point to that decided to put culture to the side for health? And how did they do that? And I don't know if we have that person, but I would love to talk to someone like that, who says, yeah, I know what culture says, but I look at my wife and my kids and I want to be here. So I'm going to go get my screening. I'm going to go get my colonoscopy because I want to be here. So I'd like to dig deeper into that. And I'll also think of that on the African-American side too. And maybe it's a conversation that we have about that, the next time we talk about culture, about these hard, entrenched values that we have in our people group. So yeah, well, I want to come back to the table with that. So Diane, leave us with something that's going to make my day go back up.
Well, what I would like the healthcare providers to have in mind all the time is that their message needs to be understood by their patients.
Yeah.
And when I mean understood, it's not just that they know what they are saying, but they believe what they're saying and they understand the importance of doing what they're saying. So your message really needs to be transmitted to your patients. Just make sure about that.
All right. And we will leave it at that. And Peter says, come back again soon. We'll have her back, Peter, for sure. And for those of you, thank you guys for being in the feed and for being so participatory today. Thank you for your comments and your questions. And we just thank you for those of you who keep following the show. If you're watching on Team Replay, you can continue to ask questions. Diane will check the feed here and there. And we'll see you guys back here again on Monday. For now, we're going to sign off. And until Monday, take care.
Thank you so much. Bye-bye.